Many people approach the medical marijuana card process as a simple transaction involving a state fee and some forms. Under Florida law, however, cannabis is a controlled medical therapy. Access to it requires strict physician oversight at every stage. Applicants frequently face denial because they treat the required medical evaluation as a formality rather than a structured clinical assessment. This comparison illustrates the difference between expectations and legal requirements. The state prioritizes clinical justification and risk screening over simple administrative tasks. Paperwork and state fees are secondary to a defensible medical evaluation. That evaluation serves as the legal foundation for patient access. To receive approval, you must clear specific clinical hurdles, confirming a qualifying condition, evaluating safety risks, and proving exactly how your symptoms impact your daily life. The state grants legal access in exchange for exhaustive documentation and transparency regarding your medical history. Ultimately, the primary requirement for legal cannabis access is a rigorous burden of medical proof. This framework shows the 5-stage process state-certified physicians use to evaluate every patient. The process begins here on the left with the confirmation of medical justification. You must arrive at the consultation with comprehensive medical records and a documented history of prior treatments. The physician needs to see what has been tried and why those options were inadequate. This requirement places a significant administrative responsibility on you before the appointment begins. You are responsible for gathering and providing the necessary evidence. A qualifying diagnosis, such as PTSD or chronic pain, is a necessary starting point, but the law requires more than just a name for your condition. You must also articulate daily impact. The physician assesses how the condition impairs your work, sleep, mobility, and emotional stability. Without documented proof of daily functional impairment, a diagnosis will fail the clinical justification test, leading to a denial. The second node of the framework focuses on patient safety through a rigorous risk screening. You are required to disclose all current medications, your mental health history, and whether you are pregnant or breastfeeding. This screening identifies potential adverse drug interactions and psychological vulnerabilities. The physician's goal is to ensure the treatment is clinically appropriate for your specific profile. Certain severe mood disorders or specific pharmaceutical regimens act as hard contraindications, meaning the physician cannot legally recommend cannabis. The physician must weigh the potential therapeutic benefits against your individual risk factors before moving forward. Providing an honest medical history is essential, as the physician is legally mandated to prioritize your safety. If you pass the justification and safety stages, the physician develops a personalized treatment plan, as shown in the third step. The doctor determines the THC to CBD ratio and the administration routes, such as tinctures, edibles, or flower, that best address your symptoms. This chart follows the standard of starting low and going slow to identify the lowest effective dose. Finding the right ratio requires patience. Immediate relief is less common than gradual calibration. The final stages of the process ensure your legal compliance and establish ongoing physician oversight. Florida law requires annual recertifications and regular follow-up appointments to monitor your progress and adjust your treatment plan. Maintaining legal access involves a commitment to a long-term, physician-monitored symptom management program. Florida's program is designed exclusively for patients with documented clinical needs. This scorecard helps you determine your eligibility based on your current level of preparation. A perfect candidate has a diagnosed qualifying condition, has gathered their medical records, and has a history of failed conventional therapies. This profile leads to a high likelihood of approval for targeted, legally protected relief. In contrast, a pause or avoid candidate is someone expecting an immediate sign-off without providing medical records or committing to follow-up care. This approach results in immediate clinical denial. If you meet the criteria of a perfect candidate but need help organizing your records, professional support is available. Specialized clinics help patients identify and request the specific medical records needed to satisfy the physician's requirements, reducing the risk of denial. Clinical preparation provides the documentation needed to secure a stable,